everyone, this is Lisa Pumphrey. Today is Friday, May 20th, 2022, and I thought I'd provide an update. I'm 30 weeks post-chemo, and I'm still doing every 3 weeks doing the Herceptin, which the Herceptin maintenance treatments have been very minor. I go on Tuesdays every 3 weeks. It takes about 45 minutes from start to finish, and I get hungry. I usually go out, have something to eat afterwards, and then I sleep real good in the afternoon. So that's been about the extent of the Herceptin maintenance treatments. I have 3 more to go, and then I should be done, hopefully, knock on wood. Today's video, thought we'd talk about chemo day and what I put in my chemo bag. There's been a couple of people who have asked me what to expect on chemo day and what did I put in my chemo bag, and what's that about. So let's begin. First of all, when I would go in for chemo day, the very first thing after I checked in would be have to get some labs. So they would draw blood, and since I'm left breast mastectomy, then they would take blood out of my right arm every time and do my blood pressure and stuff on my right arm only. And they would check my lab values to make sure I could tolerate the treatment for that day. And it was on week 3 that my blood count was low, so we had to hold off a week, and that's what we did. Excuse me. My medical oncologist, I wouldn't see her every week. I think I saw her for the first 4 weeks, and then after that was just kind of like every other week, something like that. But I could always contact her or medical team anytime, so I wasn't really concerned about that. But they did the labs, every time. And so I've got my notes here, so I want to make sure that I don't forget anything. So yeah, that was the first thing, labs, and then check it. And I got a copy of my lab values. I would always say, how they do the electronic records now, so I had set up with Texas Oncology so I could see all my lab values and I could kind of follow it myself. And so that was easy enough to do. Let's talk about my chemo bag. I want to show you my bag. First of all, let me grab it. This bag right here, see this cute little bag? I got this on my Disney cruise a couple of years ago, but now it's my chemo bag. Nice little happy guy there. It has lots of little pockets in it, that's why I liked it. I want to show you a few things that I would take and pack. And I packed this bag and kept it in my bedroom so I could just kind of grab and go and not pack every time, every week. First thing I went in here was a notebook with a pen, its own dedicated pen, so I could ask questions, and so when I saw the doctor, so I wouldn't forget anything. If there's anything urgent, of course, I would either send it through my electronic record or I'd make a phone call. But if it's something that could kind of wait a little bit, like I wanted to ask, let's see some of the things, I wanted to ask about supplements, what kind of supplements I could take. Maybe I was considering taking some other kind of supplement, and I would just write it down here, and then I would ask her first and then see what she thought. I needed to know about that booster, that COVID booster shot, when it first came out. I'd already had both of my shots prior to my treatment, so then I was kind of wondering, should I take the booster in the middle, wait till the end? It turns out she wanted me to wait till my chemo was done. I knew I had a dental appointment. I had made that ahead of time, right? And I had put it on my calendar, so now I'm in the middle of this treatment. I see I've got, in a couple of weeks, got a dental appointment, so I asked her about it. I'm glad I did, because she said, no, I really need you to hold off on that if you can. Just wait till the end of your chemo treatment, and I was just getting my teeth cleaned. It wasn't, any kind of procedure or anything. So ask your doctor about that if you have dental work or something. So any kind of question that came up went in this book. And also, if my husband had any questions, it would go in this book. If it's something that could wait, And then once we would see her, I'd open up my book and go, oh yeah, that's right, I wanted to ask you. And I was always kind of glad I did that. And then I would write her answer down. That's the other thing. I make sure to write it, what she said. And that would have it at home for reference in case I couldn't remember exactly. So, nice little notebook goes in my cute little bag. Okay? I also had, I put my iPad in there. I would do that in the morning, of course, heading out, but I always kept like a backup battery thing. I love my iPad. I take it with me everywhere I go. And My treatment was 4 hours and my iPad lasted long enough that I had this just in case, and there was free Wi-Fi there at the center, so that made me happy. But I also packed, you know, had to get my little cable for my backup battery in case. But I also packed my little earphones, so if I was listening to videos, you know, wouldn't disturb my neighbor at you know, chemo treatment. And I also packed a few little cough drops. I get a dry cough every once in a while, and you know, being there at the medical center, I didn't want people thinking, you know, she got COVID, so I'd have emergency cough drops just to help soothe any kind of dry tickle that I frequently have. And I carry a mask, you know. I had my own mask, but they seem to like these kind of blue ones best, and I almost always got one every time I went, and that's fine, no problem with that. And I would also carry some bags of tissues, which a couple times I was glad. They have tissues there, of course, but it seemed like right when I was all settled in, and those tissues that they have seemed to be a little out of reach usually, so I had my bag kind of closer to me and I could just reach in and grab my tissues, so I was kind of glad to have that. Got that in a side pocket there too. Okay, now let's talk about some other things about chemo day, and I'm referring to my list here. I also brought with me, outside of my bag, my water tumbler. In a couple of other videos I talked about this tumbler. It's insulated. I don't know what brand, and I'm not endorsing this brand or anything. I'm just saying, get you a nice big insulated tumbler with a nice straw on it. See, that's nice. Fill it up with ice, water, and be drinking on this, because on treatment day you need to drink extra water. I drink, when it was not treatment day, I would drink 4 of these a day, 2 in the morning, 2 in the afternoon, and it made me feel so much better. And I'm not a water drinker. I'm not. If you're saying to yourself, well, I don't drink a lot of water, I didn't either. But this made it easier to remind myself to drink it, and I just carried it around with me. But on treatment day, I would be drinking a whole one of these during the course of treatment for sure. And it fit, and you know, these things fit in the car, little beverage holder things that are in the car console thing too, so that's nice. I take it with me now. Even now I'm not even on chemo, I take that with me in the car. It's you know, like I said, it's Texas, it's hot, it's nice to have that to drink water, so I definitely brought that. The other thing that I brought with me in my chemo bag, I'm going to show you about the ice mittens, is what they're called, and ice booties. And here's an ice mitten, and then here is the ice boot, if you will. And these ice packs can come out if you want them to. But what I would do, I actually bought 2 pair of the gloves and 2 pair of boots, and I would stick them in the freezer. Okay, and that's where they would be. And then on chemo day, just before walking out the door, I have this cooler, and then I would just grab these things that were already chilled, and plus I throw in an ice pack in my cooler, and then yeah, that's what I would do, and carry this in. So that's what I would do with these. Okay, I put the 2 pair of mittens and the 2 pair of booties that I had kept all those in the freezer. Had this nice little cooler. It filled it up, plus a couple of those, you know, those ice packs you keep in the freezer. And carry this with me, because I would wear the, you know, the mittens and the boots during the Taxol portion of my chemo treatment. Again, that was about an hour of the 3-4 hour treatment day where I had to wear that. And what I would do too is they would let me know when it was time for the Taxol portion of the treatment. I would get up and fill this thing up with, you know, I dumped the ice water out of it, and they had an ice maker there, and I'd fill it up with ice. And I didn't have the top on, I'd kept that off, and so that's how I would be chewing on ice that hour during the Taxol. And you're probably thinking, oh my gosh, did you freeze to death? No, I didn't. I really did not. And I'm usually by nature kind of, I get cold pretty easy. And I think in part is because where I was at Texas Oncology, they have these recliners that have heat on them. So I just turned the heat on my recliner, and I was comfortable, even with chewing on ice, and had those on my hands and feet. And about 30 minutes into that treatment, I could tell that they weren't staying chilled, so I'd swap them out for the second pair of the gloves and the booties. Now, I had watched somebody online talk about the keeping this, and the reason why I did that is because I had heard and was worried that I might develop neuropathy in my hands and my feet, and they said wearing ice during that part will help reduce the neuropathy. And I can tell you, I have finished that, and other than having I did for 3 weeks post chemo, a little bit of nerve, something in my thumb and something in one of my toes, but that's since resolved. So I didn't get any neuropathy, and after, I think about, I don't know, with or without the ice packs, if I would have had the neuropathy, maybe I wouldn't have. Maybe if I hadn't done the ice packs, I wouldn't have had the neuropathy. I don't know. I just know I wore them because I learned about that from someone online. I did it, and I don't have any neuropathy, so take that for whatever it's worth. But they did recommend for the hands to wear like these gloves. So I had bought a pair of these gloves. So I put the gloves on first, and then I would reach, in the cooler, and I would put the mittens on. Now, with the mittens on, I'll tell you, when it comes to like, okay, you're going to be sitting there for an hour and you're chewing on ice, you're trying to entertain yourself. What I like to do is on my iPad, I actually like watching videos, and so there would be, I love YouTube. Of course, I'm posting on YouTube, but I like YouTube, so I might have subscribed to somebody who might have posted like an hour video or an hour and a half video or something like that. I would pick it and then play it, because now my hands are going to be with the mittens on, and you want to keep those mittens on, but I wanted, and you're not really able to kind of, scroll through on your iPad, so that I would set that up and play, and then I was fine. I had my recliner on warm, and I had usually a little warm blanket they provided for me, my mittens, my little boots, and then I could grab my little tumbler thing and chew on the ice and be chewing on the ice, and that's to help prevent mouth sores. And again, I don't know if I hadn't have done that, if I just didn't develop any mouth sores, and I don't know if that's because I chewed on the ice or I wouldn't have had it anyway. I don't know, but I chewed on the ice and I didn't get any mouth sores. So take that for what it's worth. Is that that's my testimony. That was my experience. Let's see, I want to make sure I've covered that about the cooler. Yeah, I got these things on Amazon, so you can look that up. And I'm not receiving any endorsement of any kind, so anything I'm showing you here was because somebody made a recommendation, and I went and looked for it myself, and I purchased it. So I'm not trying to mention any name brands here or make you think, but this is what would go in my cute little chemo bag here, would be these mittens, right? Next, I want to talk about, once you get in the chair, what to expect, right? Where I have my treatment done is, well, first of all, I go to the ladies' room first, because I'm going to be sitting in that chair for a few hours. So I would do that, and then once I got into my recliner, there are half walls that are between each patient, and I couldn't see my neighbor next to me. So there really wasn't like meeting your neighbor. I didn't even know or meet any other patients there that I knew had breast cancer that we could kind of compare notes or, hi, how you doing this week, or anything like that. I never did really meet anybody and establish any kind of relationship with another woman, and so it felt like, private, if you will, in the recliner in the half wall. but I could see straight ahead. I could always see the nurse's station. I can always get their attention. Okay, and I would just settle in, put my little blanket on, set my recliner. I got my little earbuds if I needed that, you know, when it was time for that. I want to talk about the port next. So I want to show you my port. So my port is right here. It's round, kind of bumpy. I never saw it before they put it in. I mean, the procedure day when I went to go get this done, it was done kind of as an outpatient thing. They did conscious sedation, and they covered my, you know, you had me turn my face and had covered, so I couldn't see what they were doing. But they were talking me through it. It didn't take very long, half an hour maybe. Gave me some, you know, some instructions, went home, and so. But anyway, this is my little port, right? So once I'm in the chair, they have this little kit, and they clean it real good, right? And then there's ivy pole, and there's several bags of things that are hanging there, but nothing's going in. And the first thing that they do, they want to insert the needle kind of somewhere in here. And there's like a syringe on the other end of it. And what they're doing is, if I understand it correctly, is they want to do a flush and make sure that port is open. So there's fluid-like stuff that's in this syringe that once they put the needle in, and what they would do is they would have me take in a deep breath and hold it while they put the needle in, and then they would, you know, push this fluid to flush it, and I could taste it. It kind of tasted a little like metal, and so I said, "Well, tasted that," and they said, you know, majority of patients do taste it, and then it would just last for a few seconds, but they would do this flush and make sure that they, you know, that was safe to proceed, and then they started with the other bags. And usually the first thing they would give me is a bag of steroids, clear, and then move on to other things. But before I forget, I want to talk more about this port, in that what the recommendation was is that to put some lidocaine cream on this, like it's a cream that you have to put on it. Not, you know, it's not, the nurse is going to do it for you when you get there. It's a cream that's a prescription strength, and so my doctor prescribed it. See my little box, and a lidocaine cream kind of looks like this. And I'm actually going to kind of demonstrate what I do. So the idea is, because this lidocaine cream takes some time for it to take effect. Otherwise, when they go to do the needle and start injecting, you know, the fluid, that can be a little, well, you'll just know that's happening, a little painful. And this cream needs to be put on about 30 minutes to an hour before they're going to put like that needle in you. So what I would do is, on the way to my appointment, now I would factor in if I needed to see the doctor or not, because that could take some time. So I might wait until I'm actually there and have my labs drawn, and I'm figuring, okay, by the time I see the doctor and by the time she gets done, I get back there, it's going to be about 30, 45 minutes. You know, you gauge it yourself. The idea is to do it ahead of time. And I'm going to show you what I do. Okay, so here's the lidocaine cream, and so I put about that much. It's a good glop. Okay, it's a good amount. It's better to have a little too much than not enough, because I did it one time where I didn't put enough, and I felt that needle, and I felt the whole time that my meds were going in, and it wasn't pleasant. It wasn't terrible, but I just knew about it. So from now on, I put a good glop. See my port here, and cover this really good, even around. But all right. The next thing is I got my cellophane here. See, so I did cellophane and I cut it in squares, and you can just put it right on top there. So this is what I had in my bag. We're talking about what things go in my chemo bag, right? So my lidocaine cream always stayed in my bag. You don't have to refrigerate this or anything. I would carry cellophane. Now I have a bigger sheet here, but I would cut up little square, so I had a whole, whole bunch of them. I always carried some paper towels and put them in my bag too, so that if I'm in the car, my husband's driving, and I'm putting that cream on, then I can wipe this off, and then that's a good hour, okay? And then that's what it kind of looks like when I'm all done, and like that. So that's how I did the lidocaine cream. So lidocaine cream and that goes in my bag. Hopefully that made sense. And then be good when it'd be good when it's time for them to put the IV needle into my port. Now let's see. We talked about the recliner, and it was warming, and the warm blanket, which was really nice. Once I got settled into the chair, they usually would take my vitals, okay, which is nothing, take my blood pressure, and they would take, my temperature, and they might ask me a few questions like, is there any issues? Then they would proceed. I have a allergy to the adhesive on the bandage. So once they would, like they take this cellophane off, they have this IV pole, and it has a box on it, at least mine did, and they would run the IV tubing through it, and they're pushing some buttons to help push the fluid. And once they inserted that, then they would usually take a bandage to kind of tape that down during my infusion. But I had an allergy to that adhesive. So if if you're the kind that has, when you go and draw blood, or you put a little Band-Aid on and you take the Band-Aid off, but where the sticky part of the bandage was on you is red or itchy, you might too have an issue with adhesive. So they would just use the paper tape or a different kind of bandage, and then there wasn't any issue. So there, just heads up on that. But they would start. They push the buttons, and then the first thing was the steroids that they would push through there. Now here's a tip for you. On the IV infusion box where they're pushing the buttons, there's a nice little timer on there with how much time is left. And you can turn that IV pole towards you so you could see that the front of the IV box. They don't mind you doing that. I mean, they can't really read the numbers from the nurse's station. Really what they're waiting for is once that time is up, so let's say it takes, 40 minutes to administer the steroids, is that the thing is going to start beeping, and that's what they're waiting for. They're waiting to hear it beeping, and once they know, then they'll come and shut that one off and then put the next bag on there. So it's okay for you to turn that, plus you can see, and that's kind of handy to know, okay, how much longer on whichever part of the infusion you're on, okay? Other tip too, let's say you're halfway through here and you realize you have to go to the bathroom. They showed me on day one where these have backup batteries, so you can unplug the IV pole and then head to the bathroom and come back and plug it back in. Don't forget to plug it back in, they always told us. So you can do that too, and feel okay. If you needed to get up and get a drink, or some people were kind of hungry, they provided little snacky crackers and things like that, and you can get up and go to their little snack area and grab those things. So that was nice. So let me see if there's anything else I wanted to tell you about. Well, I say, okay, so they did the steroid part first. Following that, where they would do the Benadryl. And man, that might have been like 20-30 minutes, and that really did make me very sleepy, okay? Which is fine. You're thinking, okay, I'm just going to kick back and I'm going to go to sleep. Except in my case, I really wanted to wear the ice mittens and booties, and my nurse was aware of that, and she, the nurses there were great, and she would say, okay, you've got, in 10 minutes, we're going to switch over to the Taxol, and give me kind of a 5-minute heads up. So I'd just kind of be very sleepy and groggy, but man, I sure wanted to put that stuff on, and I would, and I'd find my video that I wanted to play, and I'd get all set up and wear, the ice mittens, and be chewing on the ice, so I couldn't really go back to sleep because I was chewing on the ice. And, you know, when you're really sleepy and you really want to fall asleep, that was sometimes, I was like, oh no, I don't want to fall asleep. So that's the only other thing I thought I should tell you. And then by the time, that really was from start to finish, probably about 4 hours. Again, I really tolerated it really pretty well, and I would have breakfast before I would go for my treatment. I usually had a protein-based breakfast before we left the house. It's about a half-an-hour drive, you know, to the facility, so you know, I would probably an hour before, or half an hour before leaving, I guess, I would have a protein-based breakfast, and I did fine. I didn't have any nausea or vomiting, and if you do start to feel nauseated, which I have to say, of all 12 weeks that I was there, and I think they would take care of about 10 patients at a time. I think I heard one time one lady felt a little nauseous, and they were ready right then to give her something anti-nausea. But I didn't. I saw a lot more men during treatment day than women, and I don't know their situation or anything like that. I'm just saying, as far as like if you're worried about getting sick on that, I did not see that, experience it at all. And the nurses, of course, were great in being, you know, ready with things. I think, here's the thing though, I do remember this now. I did get nauseous, and I think I was more scared. I think the nausea was due to me being scared, not because of the medication. And I seem to remember asking, can I get, yeah, I did. Can I get something for nausea? And the nurses had to get with the doctor first, so there was some time in having to reach out to her, and I think there was something about getting insurance to cover it. So it wasn't like a minute later they were right there with something. I mean, they were having to go through some phone calls and things in order before I could get something, and then I did. And then they said the following week. Anyway, it turns out that I didn't need it anymore after that time. Like, I think that was just fear-induced nausea, if you will. And then after that, I didn't feel like I really needed it, and I didn't ask for it. But I do remember that was kind of like, oh, you have to do all of that first. So here's the thing: if you think you might be nauseated because you're scared, or you're just that easily, you know, can be, talk to your doctor about it. And say, yeah, I'm really worried about nausea. Can we go ahead and prescribe that and have that on the ready in case I get nauseated? Okay? And just kind of do that ahead of time when you're with, you know, talking with your doctor. Next, I want to talk kind of about, I think this is the last thing. I'm going to wind this down. Next thing is about insurance and paperwork and stuff like that. So I started a 3-ring binder day one, and I got receipts on everything, and I'm glad I did. I'm glad I did. I know, I'm more of a paper person, and there might be people here that says, you know, I can't be bothered with all the paperwork. But there have been times where insurance things get delayed and so forth, and then questions would kind of come up, and so I was able to say all of my explanation of benefits when I would get them from the insurance. I would print them out, put them in my notebook in date order, like my service date, because I had to have echoes, ultrasound on my heart because of the Herceptin. Had, you know, some follow-up things. Okay. Excuse me. So I put it in here in my notebook and kept track of it, as far as if I paid any of my copay or if I did not, or you know how if you pay a copay and they say, do you want a receipt? I always said yes, and got a paper receipt and stuck it in my notebook. I tracked all of that, and I am glad I did, because there were a couple of times I had to refer to them, and it was good to have that. So I think that's really the gist of it. That I really wanted to cover today is my chemo bag, and of course I had that pretty well packed and ready to go every week. I had kept all of my ice mittens and ice boots in the freezer and had my cooler, and I would pack that up. I would always load up my tumbler, asked my best friend, actually, really, drink a lot of water really helped me feel so much better. I couldn't believe it. Could not believe it. I'm just not a water drinker. And I was amazed that when I would start to feel kind of sluggish and run down, ugh, and I would go, oh, I haven't had any water in a while, so I would drink some water, and it was just like an instant kind of refresh, and I couldn't believe it. And that's what I would cart with me on chemo day. So, see, this is a long video. I'm going to conclude it. I'm just going to tell you thank you so much for watching my video. If I hope I've helped you in some way to kind of understand a little bit about what to expect, and I wish you well on your journey.